So this is the femur. The femur articulates with the acetabulum of the pelvis. The femur is made up of the femoral head, the femoral neck, two trochanters. So the higher one is called the greater trochanter, and this one is called the lesser. So it's smaller and it's lower. And then this is the body of the femur, or the shaft. Now this is the anterior surface. So the greater trochanter forms an attachment site for a lot of the gluteal muscles, which arise from here on the iliac crest or the iliac wing. And the gluteus minimus is the one that inserts most anteriorly. And if we rotate the greater trochanter, it has a lateral facet. So the anterior facet is in black here, that's where glute min inserts. The lateral facet, that's where glute medius inserts. And around the back there's a second band of the gluteus medius called the posterior superior band, and it inserts on a little facet around here. So if we stick to the femur, between the two trochanters is a little line known as the intertrochanteric line. Surprise, surprise. And then down the distal end of the femur, we have a medial and a lateral epicondyle. And this, of course, is where the bone articulates with the tibia and the patella. Now, these red markings are origins for the quadriceps muscle group, which sit on the anterior femur. So there's a vastus lateralis and a vastus medialis that inserts here. And then vastus intermedius, which occupies most of the femur. And as the name implies, it sounds like in between. The lesser trochanter is very important. That's where our iliopsoas tendon inserts. And out here, these are the abductors. So the greater trochanter is those gluteal tendons, and that's a group known as the abductors, meaning that takes it away from the body. In the femoral head, which is obviously usually covered by cartilage, there's a small depression here called fovea capitalis, and that's where the blood supply enters the femur, and also a ligament, ligamentum teres, which joins the femur into the acetabulum, arises. And that's the anterior surface of the femur.